I would like to take the chance of thanking the organizing committee for this brilliant congress. So as a clinician, I am overloaded with basic science, so thanks to you all for giving me that opportunity. Dear chairpersons and the venerable audience, the name of the congress is Targeting Microbiota Towards Clinical Revolution. If you have not heard anything revolutionary yet, for the next few minutes I'll try to convince you that there is a revolution in our side at least. Our study was built on some facts. Fact 1. By definition, bacterial vaginosis is not an infection, but one of the 3 vaginal dysbioses. Fact 2. Bacterial vaginosis is conventionally treated with metronidazole. And fact 3. Antibiotics are not clever drugs, so they cannot discriminate between the normal level and excess microorganisms. Moreover, they lack specificity and affect the entire microbiota. Based on those facts, we designed a study to compare the microbiota response to oral metronidazole and to oral probiotic treatment in the same treatment schema for bacterial vaginosis. At the initial visit, we established a clinical diagnosis using AMSEL criteria, excluding microscopy. 91 patients were initially recruited. We obtained the vaginal swabs for culture and human papillomavirus co-testing. We included patients between the ages 20 and 40, which is accepted as mature, non-smoker, omnivore, non-IUD and non-contraceptive user, no systemic illness, and no sexual intercourse in the past 2 weeks. After having receiving the vaginal culture and HPV co-testing results, cases with mycoplasma, uroplasma, chlamydia, and cases with mixed vaginal dysbiosis with and or trichomonas were excluded. Additionally, patients who had menstrual or abnormal vaginal bleeding who engaged in sexual activity during the treatment and the ones who deviated from the treatment protocol were also excluded. So we have reached a sample size of down to 28 with pure bacterial vaginosis. We used a computer-generated pre-randomization according to the order of admission. 15 patients were allocated to probiotic group, while 13 were to metronidazole group. One patient in the probiotic group and 4 patients in the metronidazole group came back before the completion of the treatment with severe vulvovaginal candidiasis, so they have given antifungal treatment, so they were excluded from the final analysis. And finally, we have reached down to probiotic group with 14 cases and metronidazole group with 9 cases, and both groups were comparable in these criteria, which is not different from each other. One of the most important reasons why clinicians prefer antibiotics over probiotics is the short use of the treatment. Probiotics are conventionally given either intermittently or continuously for longer periods like a month or so. The title of the current study bears the word unique because we gave the probiotic orally at a very unusually short schema to the disadvantage of the drug, which is 1 week only, like the metronidazole. And we have used a preparation consisted of probiotic, prebiotic, and cranberry, namely BellaVie for women from Belgium, were given 7 days orally twice daily, and so was the metronidazole. Here is the result in both groups before and after the treatment in terms of total vaginal biomass, lactobacillus species, and 2 lactobacillus strains, which was proven effective when given orally. And the statistics we have used is written down there. But this is a busy table, so I'm not going to help your eyes and mind with showing you graphics instead of the table. There is no significant difference between between the two groups in the start of the study, but the total biomass has increased with the metronidazole treatment. So this is interesting, but this was due to the increase in Candida species. Remember that 4 patients has already dropped out from the study before the completion. So this is this diagram shows that the total biomass was constantly stable throughout the treatment with the probiotics, which shows that you replenish the lactobacilli. And this is the, is it here? Okay, here. So this is showing the lactobacillus species before and after the completion of the treatment, which is not a surprise to us. And this is the lactobacillus and rhamnosus acidophilus species in 2 groups, which is given orally and which is colonized in the vagina. Because if you give them vaginally, you never know if the lactobacilli is coming from the medicine which was introduced the day before or colonized already, which the desired effect. So this shows that colonization takes place with the oral treatment. So, in conclusion, there was no side effects with oral probiotic treatment, while there was 4 severe Candida dysbiosis with the metronidazole. And probiotics are normally given an add-on treatment to antibiotics. But this study shows that they are still effective when given by themselves without the antibiotic, even with an unusual schema, which is 7 days shorter than expected. As this was a preliminary study, of course further studies are needed, but this was performed to see the size of the effect. Now a larger study will commence soon to see the real life results of probiotic treatment for bacterial vaginosis. Thank you for your attention. Okay. Do we have questions?